Let's talk further about all of this. Joining me right now is Dr. Owais Durrani. He's an emergency medicine physician out of Houston. So good to see you, doctor. So lots of confusion. Let's zero in on that, particularly on the whole, CDC guidelines of isolation from 10 days to 5 days. What are you hearing from patients?
Yeah, thanks for having me. A lot of confusion indeed. When I see a patient in the emergency department, we do a large workup, and then I sum that workup in about a few sentences and give them some discharge instructions. And I feel like the CDC needs to do a better job of that. They have a lot of information, a lot of data, and they really have to condense that down into clear messaging. My patients are confused about how long they should isolate, if they should test, when they can go back to work or school. And it's hard for me to give them clear guidance because the CDC's guidance honestly has me confused at times as well.
But should it also be expected that there are going to be fluctuating instructions because this virus is changing? It's constantly evolving, and so guidance has to constantly evolve as well.
I 100% agree. And I think a lot of the changes that were made, the 10 to 5 days, were in the interest of kind of being current with the science and the evolution of Omicron and what we're seeing. I think it's been said over and over again, we just wish testing was a part of it. I tell my patients, if they have access to test negative twice in subsequent days, and then you can come out of isolation. If you don't test negative, then day 10 is when you can come out of isolation.
And on the issue of tests, it's very difficult to find. I mean, you pull up to any Walgreens, CVS, Duane Reade, and there are signs on the front doors or at the pharmacy windows that say, we don't have any tests. So when the White House says it has a plan to send as many as 500 million tests to Americans, how helpful might that be? How urgently do you think that is needed?
Yeah, we needed them last month, essentially. We need them now. And 500 million honestly won't be enough. Every American should have at least 2 to 3 tests per week to be testing, and 500 million is not even going to get us near there. Because there is such a shortage of tests, we are having a huge rush on our emergency departments of people wanting us to test them. And that's leading to a delay of care for critically ill patients, people showing up with heart attacks and strokes because we're understaffed as it is, and we're having to take care of the sick patients and then all these patients who want COVID tests. And so it's a really complex and difficult situation for us.
And is it the case at your hospital? Are you experiencing that patients are discovering they are positive with COVID because perhaps they are coming into the hospital for other ailments? They don't have access to at-home testing, only to find out that not only do they have this other problem, like you just mentioned, maybe a heart issue, but they're also testing positive, and now you have to treat them for multiple issues.
Absolutely. So that is the case. In the big kind of grand scheme of things, it doesn't change anything for us because we still have a lack of beds and a lack of staff. And whether you have COVID or don't have COVID, we still have to take care of you. It actually makes things more difficult. So, for example, if you came in for a stroke and my hospital doesn't happen to have a neurologist, I have to transfer you. Now, finding a bed for that patient is hard enough. Now, when I get on the transfer line and tell them this patient is COVID positive, you have to find a hospital with a neurologist and an isolation bed that's available. So that makes caring for even non-COVID related issues, even if you're asymptomatically COVID positive, that much more difficult.
So, Dr. Durrani, how do you see our way out of this? Or are you resigned to the fact that we will all just simply be living with COVID, but the degrees in which we live with it may vary? Which approach are you advising?
Yeah, so I never give up. I always think there's a solution. I just think we need to make some hard decisions in the short term. The good news is we've learned from other countries that the spike goes up real quick and comes down real quick. And so that means for about the next 6 weeks or so, we need to make some tough decisions. That's going to be wearing masks everywhere and N95 mask if possible. That's going to be the federal government finding creative ways to get us tests, whether that's the Defense Production Act or whether that's buying tests from other countries or whatever the case may be. We need tests now, setting up testing centers, and then redoubling our efforts on vaccinations. We have a very abysmally low percentage of kids that are vaccinated in this country, and we don't talk about that enough. And our pediatric hospitals are now starting to see a surge in admissions. And so focusing on boosters, we are falling behind on that, focusing on childhood vaccinations, and making some tough decisions when it comes to non-essential events over the next 6 weeks. But I think if we do those things, we can get out of this and then kind of look back to see what the mistakes were we made over the last couple of months and make sure that we don't do this all over again in a couple of months.
I hear you loud and clear. It sounds like you're saying people need to take a lot more personal responsibility to help be part of the solution here.
Absolutely. It's on all of us. The system's got to do its part. We've got to do our part, and we have to look out for each other.
All right. Dr. Owais Durrani, thank you so much, and continue to be well. Appreciate you.
Thank you very much.